Ketones. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is ketones. The subject of this unit is ketone monitoring in the school setting. Participants will be able to understand what ketones are, why ketones are monitored, when ketones should be monitored, when to contact the school nurse, parent guardian, or healthcare provider. Participants will also be able to demonstrate how to check ketones. Ketones are acids that result when the body does not have enough insulin and uses fats for energy. Ketones may be observed when insulin is not given, during illness or extreme bodily stress, or with dehydration. Ketones can cause abdominal pain, nausea, and vomiting. Without sufficient insulin, ketones continue to build up in the blood and result in diabetic ketoacidosis. Reasons for checking ketones. It is important to test for ketones because they can build up in the body and result in one of the two emergencies of diabetes: diabetic ketoacidosis, often referred to as DKA. DKA is a condition that occurs due to insufficient insulin in the body. This can be due to illness, not enough insulin medication doses, or omitting insulin injections. If the measurement shows medium or large ketones to be present, extra insulin may be needed if specified in the student's diabetes medical management plan to reduce the level of ketones. If the ketones are not detected early, particularly during illness, they will continue to build up in the body and DKA may result. DKA is the #1 reason for hospitalization in children with diabetes in the U.S. It is the early detection of ketones and treatment with insulin that prevents hospitalizations for DKA. The individual student's DMMP should specify when ketones are to be checked. Generally, ketones should be checked when repeated blood glucose readings are over the target range as specified in the care plan, during acute illness, infection, or fever, if the student has any of the following symptoms of DKA, such as nausea, vomiting or diarrhea, abdominal pain, fruity breath odor, rapid breathing, thirst and frequent urination, and fatigue or lethargy. Unlike low blood glucose, which can progress very quickly, the progression of untreated high blood glucose to DKA is usually a slow process. An isolated high blood pressure reading in the absence of other symptoms is not cause for alarm. DKA usually develops over hours or even days. However, DKA can progress much worse quickly for students who use insulin pumps or those who have an illness or infection. Individuals with diabetes are most at risk when symptoms of DKA are mistaken for flu and high blood glucose is unchecked and untreated. Note: ketones can be measured in either the blood using a ketone-specific meter or in the urine. Urine ketone measurements continue to be the most common used in the school setting. Urine ketone checking instructions. Gather your supplies. Gather a vial of ketone strips and a urine cup. Student urinates in the clean cup. Put on gloves if performed by someone other than the student. Dip the ketone test strip in the paper cup containing the urine. Shake off excess urine. Wait 15 to 60 seconds as indicated on the directions printed on the bottle label. Read the results at the designated time by comparing the color on the strip to the color chart printed on the label on the bottle. Be careful not to wait longer than recommended to read the results, or false results may occur. Record results and take action per the student's DMMP. When recording results, record the descriptor from color coding on the packaging. Record both the word and numerical results label. For no ketones, no action is needed. For trace ketones, encourage drinking water. For small ketones, continue to encourage the student to drink water. For moderate ketones, the student needs insulin. For large ketones, insulin is critical. Generally, ketone strips stored in bottles expire 6 months after opening. However, see bottle for details as expiration after opening may vary according to the brand. Ketone strips stored in individual foil packages expire according to the date on the box or the foil package. When preparing to check for ketones in the blood, prepare a lancing device. Wash hands using warm soapy water and dry them completely. Remove the test strip from its foil packet. Insert the 3 black lines at the end of the test strip into the strip port. Push the test strip in until it stops. The monitor turns on automatically. Touch the blood drop to the purple area on the top of the test strip. The blood is drawn into the test strip. If the monitor shuts off before you apply blood to the test strip, remove the test strip from the monitor and try again. Continue to touch the blood drop to the purple area on the top of the test strip until the monitor begins to test. The blood ketone result shows on the display window with the word ketone. The result is stored in the monitor's memory as the blood ketone result. Please review the ranges for ketone values. If ketones are present, treatment should follow the recommendations specified for the individual student in his or her DMMP, including the notification of parent, guardian, and/or student healthcare providers as appropriate. Generally, allow free use of the bathroom. Students should be encouraged to drink sugar-free, calorie-free liquids like water or diet soda. Students who are nauseous and vomiting may need to take in liquids slowly to avoid more vomiting and dehydration. Extra insulin may need to be given. The student's DMMP should specify what dose should be given for the blood glucose and ketone test results. Students should not engage in physical activity per the DMMP. If vomiting occurs or if student is lethargic with ketones present, parent guardian should be called or call for medical assistance if the parent guardian cannot be reached.